My name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I am joined by Dr. Stephanie Neider of Northwestern Dermatology and Dr. Scott Spicer of Northwestern Pediatrics. And we're going to be talking about some summertime issues that will often arise for families. So welcome to you both.
Thank you.
Thanks for being here. So we're going to have some fun talking about summertime issues to help families out. But first, maybe introduce, I know you've both been on the show before, but just introduce yourself and where you're practicing, and that will get us started.
So I'm Dr. Scott Spicer. I practice in Enosburg Falls with Dr. Haig, and good time to bring up that I'm actually going to be starting some time in Swanton. Dr. Chippinelli and I have been working to try to expand the hours in Swanton. So starting in July, I'll be in Enosburg on Mondays and Fridays, and then Swanton on Tuesdays and Thursdays. That way, Dr. Chippinelli is there on Mondays, Wednesdays, and Fridays, so that opens up the office for 5 days a week.
Excellent.
So, and with that move, Dr. Laura Bellstrom will be in Enosburg on Wednesdays, so there will always be a provider in Enosburg as well on all 5 days of the week.
So full-time pediatrics in Enosburg and
Yes.
full-time in Swanton.
Yep.
Well, great. Thank you so much. Thanks for being here. Dr. Neider, welcome.
Welcome. Thank you. My name is Dr. Stephanie Neider. I practice at Northwestern Dermatology, which is over on Fisher Pond Road, just as you come off the highway. I've been there almost 3 years, and I see patients Monday, Tuesdays, and Thursdays, and some Wednesdays.
Great, thank you.
Yeah.
So we've got a combination of pediatrics and dermatology. So we're going to be talking about a lot about skin issues, especially for families and children. So since we are coming into the summer time now, let's talk about sunburns. And what's your advice on sunburns, first preventing it, and also how do we treat sunburns? So maybe some advice for families.
Okay.
We're going to go back and forth. It's going to
I
be
will
fun.
talk about that. So I think there's many different ways to treat sunburns. I think sometimes we get stuck on sunscreen, and sunscreen is a great way. But also clothing, I think, is underrated. They make nice rash guard swim shirts, which I think are great because it's hard to keep reapplying with a sunscreen. It wears out over time. And if you're in the water, if you get a very resistant sunscreen, a very water-resistant sunscreen, it only lasts 80 minutes. And so then you have to remember, and that's the highest rating they have for water-resistant sunscreen. So you have to reapply every 80 minutes. It's very easy to miss spots on your back and your shoulders, and even if you try to do a really good job. So I prefer swim shirts, and they, there's a lot of companies that make really good swim shirts. Hats, umbrellas, shade, so seeking shade. Also just avoiding those midday hours if you're going to be at the beach, going in the morning or going a little bit later after 4 in the afternoon. Those can all be ways to decrease your amount of ultraviolet exposure. Then as far as sunscreens, you want to find something that works for you, that you don't mind the feel of, that you're going to use.
That's a good point.
Yeah. And so,
Broad
sorry.
spectrum is kind of the key, I think, making sure that both UVA and UVB are covered. But for kids, I also try to emphasize that even you don't have to be in the sunlight directly to have injury from sunlight. So recognizing the reflection off of water and pavement and windows and things like that.
And snow. Yeah, a lot of people get sunburn on the underside of their nose if they're skiing. So, yeah, when people get some skin cancer, they're like, how did I ever get any sun there? Well, there's the reflection from water.
We don't think of
and
that.
snow, yeah. So you can get that underside of your nose and stuff. Also lips, you want to make sure that you sunscreen those. They make a lot of lip balms with sunscreens. That's another area people don't think about. Ears, back of the neck, all those spots. As far as broad spectrum, so they should have a label on it that says it prevents skin cancer as well as sunburn. If it just says it prevents sunburn, then it's not giving you enough protection. For kids, I like mineral sunscreens for babies, right? The zinc oxide or the titanium dioxide.
Yeah, I think they're the ones I always tell parents remind you of diaper rash creams because they have the kind of white and messy, but the least likely to cause sensitivities and rashes, and especially with younger kids, they tend to be really sensitive to some of the more complex chemicals that are in some of the newer sunscreens.
Right, yeah, so there's two types of sunscreen. There's a chemical sunscreen, which basically absorbs the light, the ultraviolet light, and turns it into heat. So, and then there's the mineral sunscreen that basically just reflects the sun off of you. And so the zinc and the titanium are mineral, and then all those other avobenzone, parsol, oxybenzone, benzophenone, oxysalicylate, those are all chemical sunscreens. So a lot of sunscreens mix those ingredients to give a wider spectrum, but titanium dioxide is the widest spectrum mineral sunscreen, and it has a really wide spectrum, so it's a good one. Yeah.
So for anything else for children, as far as you want to mention regarding protection from the sun or being in the sun?
So I think just getting back to going with the sunscreen, I usually recommend an SPF of 50, like 45, 50. And then some of the higher numbers, I think the expense is probably not worth it's worth spending the money to get more of the SPF 50 and to reapply it regularly like you're supposed to.
Yeah, I think that's a good recommendation.
Good practice.
I think that's a great recommendation for if you're going to be outside enjoying the sun. I like to get almost everybody using a morning moisturizer with a sunscreen in it, just to give them a base layer. It's going to decrease the total exposure that you're, at least on your face and neck, have over your lifetime. If you can just get in the habit after you brush your teeth of putting base layer sunscreen, they make a lot of good morning moisturizers. Next, Neutrogena, Eucerin, Aveeno, Oil of Olay, all these brands make a lot of nice morning moisturizers with the sunscreen. And cosmetically, like a 15 or a 30 feels better. It's not going to be as thick and greasy. So for an everyday, under your makeup or everyday application in the morning, just as your base layer, even if you're just going to be working inside and stuff, that's a nice one to go to. But definitely if you're going to be outside enjoying the sun, I like a 50, yeah.
Excellent.
Yeah.
Great. So we're getting some hot, sunny weather, which is fantastic. Yes. So we make sure protective clothing, I'm hearing, and also making sure sunscreen, putting on that base layer of moisturizer, and then making sure we have that 50 or above, and then applying regularly the 80 minutes is interesting to hear. So then we start thinking about other summertime things and out playing in the grass in the woods, and we start thinking about poison ivy, and those types of summer rashes. And so what's your recommendation regarding, well, obviously there's a prevention factor, I'm sure.
Yes. Prevention is always very
Stay
important.
out of it, right? And then the treatment. So let's talk about that a little bit.
Yes, so the poison ivy, poison oak, they're a certain type of reaction it's a little different than your typical fast allergic reaction. It's a cell-mediated reaction that occurs within the skin. It's a compound that's in an oil, and so unfortunately a lot of times the rash starts a little while later, and so you may have had time to spread and get it into other places. So the first thing, once you know that you have been exposed or start to see a rash that you think might be that, is washing really well with the soap and water and trying to get rid of the oil. And then the rash itself, you can get redness, itchiness, it can blister, and the treatment is best early on before it has a chance to get really blistery and raw. And if you have large areas that are involved, it's definitely a good idea to be seen by a physician, since it's we often will treat with prescription topical steroids, or if you have rashes on the face or large areas, we may actually do oral steroids like prednisone. The topical things that a lot of people use, like topical Benadryl, and they're not really going to help, and they may actually increase sensitivity, so we usually recommend avoiding that. The antihistamines like Benadryl, so antihistamines in general don't really help for poison, even though they're really itchy. It's not a histamine-mediated reaction. The benefit really is with the sedating antihistamines like Benadryl or some of the prescription ones, and that's really for the sedating effect. So at nighttime when they're really itchy and restless and can't sleep, that's when they're probably helpful.
Some Benadryl for that.
So the other we don't see a lot, but is often in the news, are exposures to things like the wild parsnip or hogweeds, and those type of reactions are a little different than the poisons. It's a dermatitis that reacts to sunlight, so it requires the sun exposure as well as the contact with it, and so those rashes may show up 24 hours later after you've been exposed to sunlight. So if you're going to be working in the weeds and you know there may be exposure, the best thing is going to be to wear long sleeves and long pants and just keep the stuff off your skin, and then wash the clothes, wash yourself to kind of wash those things off before they have a chance to get exposed to the sun. And
Great. So first, stay out of it if you can, or protect yourself from it. And then if you do get it, make sure you're washing and keeping the areas clean, and maybe some Benadryl, unless it gets more substantial.
Right, and sometimes those reactions can also blister, or you can just get redness, but they tend to be painful and not itchy, whereas poison oak, poison ivy, things tend to be really itchy.
Okay.
So.
Great. Thank you.
You're welcome.
And what about the dermatologist?
Just going back to sunburn just for a second, just a couple easy things you can do at home for sunburn would be to take a cool bath or shower. That feels good on the burn. And then put a moisturizer with aloe on afterwards.
Okay.
And if it's real painful, you can use some cortisone over the counter. And then take some ibuprofen. Yeah, that can help a lot. If you get blistering, that means you've got a 2nd degree burn. You're never going to get more than a 2nd degree burn with a sunburn, because the ultraviolet radiation only comes down to the dermis. So at the most, you'll get a 2nd degree burn. But you want to leave the blister roofs intact so that can protect the skin underneath, and kind of just let them dry up and go away on their own. So.
Okay, so don't break your blisters.
You can, if they're causing a lot of tenderness because of the pressure on them, you can sterilize the needle and just poke them and let them drain, but leave the roof intact.
Okay.
Over top of them.
Let it dry down.
Yeah.
Okay.
Yeah.
And once they've ruptured, you can use a little bit of soapy water to kind of wash, and then they often recommend kind of moist gauze, like Vaseline-infused gauze, for example.
Yeah, or an aloe
soothe.
moisturizer. Yeah, you can wrap it in Vaseline too. And
Okay, that's good.
Yeah,
Thanks for that
to help.
add-on.
And then for the poison ivy, I mean, things you can do at home, if it's a limited area and you don't need systemic steroids, I like the sedating antihistamines. Also, you can use some cortisone over the counter on it, the cortisone 10. And if it's real weepy, sometimes it gets real, weepy, and you get the little tiny blisters and they weep. There's a soak you can buy over the counter called a Dumburo soak that will dry that out pretty nicely.
Oh, wow.
Yeah, it's just a little powder you put in warm water, and then you can put the soak on yourself. So, as far as poison parsnip, it's really endemic here. Like, there's a field next to my office that's
News
full
to
of
me,
it.
by the way. I never knew there was poison parsnip.
I think it was the early settlers ate a lot of parsnip instead of potatoes. Like, that was like a root vegetable that they ate a lot of. So it's probably left over from.
And so what does this look like?
It's like almost looks like it's
Maybe our
Queen
viewers
Anne's lace,
already
but
know
it's
this, but
yellow,
I'm,
and
like, clueless
it's got
to
lots of
person
little
here.
tiny yellow flowers on it. And it has a compound in it called psoralen, which is a photosensitizing compound, which we actually use in dermatology. We use it, we can give it to you orally or topically. We can make it into an ointment for some treatments for psoriasis and cutaneous T-cell lymphoma and vitiligo. It's used, honestly.
Oh my gosh.
And it's been used for like thousands of years ago. They were using it in India for vitiligo because it's in a lot, this compound is not just in poison parsnip, it's also in like figs and lime rinds and lemon rinds, citrus fruit rinds. So like a lot of bartenders will get it on their hands from squeezing from the limes if they're working out in the sun in an outdoor bar. Yeah.
Oh, wow.
Yeah.
And it's the vitiligo because it can lead to hyperpigmentation afterwards, right?
Yeah, it sensitizes it actually sensitizes the skin, and then with the light, it suppresses the immune system in the skin. So that's why we use it for these auto-inflammatory diseases like psoriasis. And vitiligo is also an autoimmune disease, so yeah.
So with the poison parsnip, do you treat it the same way as poison ivy? I mean,
it's different. So poison ivy, so it's a phototoxic reaction. So anyone who comes in contact with it and has a certain amount of sunlight will get it.
Okay.
You're gonna, after you get it on your skin, you're gonna be most sensitive to sunlight 30 to 120 minutes afterwards.
Okay.
And then if you just get a little bit, you might just see a red area.
Okay.
Like you might not get a blister, but if you get a high enough concentration, then 24 to 72 hours afterwards, you'll notice some blistering.
okay.
And then after that, after the blister goes away, you're gonna be left with a dark pigmented spot there. So, and that can last 6 months to years and years.
Wow.
Yeah.
Interesting.
Yeah.
Wow.
So I had a family once who came back from the Caribbean and they've been like squeezing limes and lemons all over the place. They all had like speckles of brown spots on
Oh my word. This is crazy.
Yeah.
Boy, I'm learning more from this show. I'm hoping our viewers are as well. Okay, so moving on from all of this, it just can only get better, right? So let's talk about bug bites and what you're seeing for bug bites and how you treat them. And maybe we could talk a little bit about ticks too, since this is, it always seems like it's a bigger year than the year before, but let's talk about bug bites.
Yes. So definitely we are right in that time of year where there are lots of insects. We have lots of mosquitoes, black flies, and all kinds of bugs and lots of ticks, especially the deer ticks. So bug bites can give you a whole range of issues, from just localized irritation to systemic reactions like allergic reactions, and then of course with the ticks you have to worry about being vectors for diseases like Lyme disease, and that's really the main disease that we worry about in this area, since we are in that part of the Northeast where Lyme disease is very prevalent now. So prevention is really the most important thing that I always try to emphasize at visits, and so using insect repellents that are effective, and DEET is probably one of the most effective insect repellents, and it's been around for 70 some years. And
that's safe? DEET is safe?
Yes.
Okay.
You know, there have been,
That's a myth. I just want to put that out there. Okay. DEET
somewhere
is safe.
around 20 cases in the 70 years around the world of adverse events, and those were all from ingestions as opposed to.
Okay.
So in theory, extensive application repeatedly and chronically can increase your risk of systemic absorption, but in terms of your everyday use, that shouldn't be an issue.
Okay.
With children, the Academy of Pediatrics recommends around 10 to 30% DEET rather than some of the higher concentration. I think one of the biggest deterrents is the fact that it is kind of oily and greasy, has an odor, and does tend to break down things, some of the plastics and rayon and things like that. So, but it is really probably for ticks, it seems to be one of the more effective ones. So with this time of year, we see a lot of kids with bug bites that have large localized reactions, and you can see, particularly for mosquitoes with young kids, they have a very pronounced reaction or sensitivity to one of the proteins in the the saliva of the mosquito, and you can see a very large red swollen area that almost looks like a cellulitis. They can even sometimes have some fevers and chills, and it can be confusing to tell whether it's infection or if it's just a large localized reaction. And the key to tell that difference is the exposure, the time of exposure. And if it's been within a few hours to the first day or so, then it's typically just a large localized reaction. If it's 2 or 3 days later and you start seeing that, then that's more likely a cellulitis or infection that would need antibiotics. But typically the treatment for bug bites is antihistamines, Benadryl. You can also use Claritin or Zyrtec, and sometimes when you're really itchy, you can even use Zantac as well. And then, of course, the topical antihistamines with the caveat of trying to avoid a large area just so that you don't get too much systemic absorption, especially with smaller kids.
So when would you want a parent to think about bringing it to you, to the doctor, when you have a bug bite? I mean, what should they look for? Like, you need to be seen.
I think any concern on whether there's infection should definitely be seen.
Okay.
Sometimes...
so prolonged redness and...
Right. And if there's any concern that it looks like it is infected, I think being seen just to make sure it is or isn't is important. And kids in particular, they can scratch and cause infection from scratching, and so sometimes you can see something that started as a bug bite that turns into something more involved, and so.
All right. Super. And anything from your perspective, Dr. Neider, regarding that can be?
Well, definitely if it has that bullseye target look, like just moving into tick. If you think it was a tick and you're getting that kind of the surrounding erythema with the lightning, or sometimes you don't even get that lightning in the center if it's just kind of growing and growing. It could be Lyme's disease. And then if they have like a fever too, or swollen lymph nodes, or feeling achy, that also could be Lyme's disease.
And a lot of the Lyme, so the kids that present with those rashes are the ticks that they never knew that they had. So people talk about the bullseye rash. Any sort of feeling sick and achy, having some fevers, and if you have round red rashes, either one big spot or several spots, it's always a good idea to see a provider. In general, with ticks, if you find a tick, you want to take it off as soon as you can. Generally, they recommend using like small tweezers or microforceps and just getting a firm hold as close to the skin and just gently pulling straight out. A lot of times, little mouthpieces will break off, and they found that if you try to dig to get those, you actually increase risk of infection. And so, little pieces that are left behind, you just leave, and they get ejected on their own, just like a superficial sliver would. But the common question comes back to Lyme disease and prevention of Lyme disease. And what we know for some of the studies that have looked at tick bites, transmission of Lyme in those areas where it's endemic, you really have to be on for 36 to 72 hours. So if you find a tick that's not engorged, then they do not recommend antibiotic prophylaxis. So if you're able to take it off on your own, and that's why I always recommend trying to make tick checks part of your daily bedtime routine, especially looking in the hair. If you can find them and get rid of them before they get engorged. If you find a tick that's engorged, then it's not a bad idea to get seen by the pediatrician or physician and talk about options. But the studies that have looked at the transmission, if the tick is, one of the better studies that they had showed that under 70 hours of, if the tick's been on for less than 70 hours, the risk of transmission is around 1%. It's really after that. Basically, the Lyme is in the gut, and the tick has to feed enough to start refluxing back to the mouth, and then from the mouth into the skin. And so if you get the tick off before it has a chance to get engorged, then you don't have to worry.
Great. Yes.
Yeah, I just wanted to add one little.
Yeah, I know, and then we'll close out. But yeah, we could just go on. This is really interesting. We'll have to have another session. But yes, Dr. Neider.
I read a study a couple years ago where they sprayed the socks with permethrin, which you can buy over-the-counter permethrin sprays, and we actually use it. It's very safe. It's like a medication to use.
Use it for head lice.
Yeah, and for scabies too, all over the body. And you can buy it like on Amazon or probably at your local drugstore here, a permethrin spray. If you spray your socks with permethrin, you're 70% less likely to get an attached tick. So if you before you go outside. So if you're going to take a hike in the woods on top of the DEET, just spraying your socks or shoes down with some permethrin spray would be a good idea.
That's excellent.
Yeah.
The other thing is when you know if you're taking a hike, when you get back, taking a shower as soon as you can helps to reduce the risk of the tick actually biting and staying on. So.
Yeah. Right.
Great.
And putting your socks over your pants and wearing long sleeves and all that kind of
Full
stuff.
garb, right?
When it's 90 degrees and humid is always fun.
Wow. I think we've overwhelmed our viewers. So thank you so much for being on the show today. Really appreciate that and really helping families and their children to protect as much as possible against the impacts of being out in the sun and having fun, and maybe a little bit too much, and also those bugs. So thank you so much. And the poison parsnip that I learned about today. So I'm Jill Bowen, CEO of Northwestern Medical Center. Thank you so much for joining us for a Health Beat today and learning about protecting ourselves from sun and also the bugs, because we want everybody outside being active and enjoying this beautiful summer Vermont. Thank you.